All right, so after looking at the schedule, we're moving through the material very quickly. Let's throttle off and take a little bit more time in the anatomy section. So we have time to cover the intrinsic laryngeal muscles. And if I were to pick two things for you to carry with you from this course, it would be at least this anatomy section of this course. It would be the cranial nerves and the intrinsic muscles of the larynx. So the intrinsic muscles of the larynx, as we said in the previous lecture, these are muscles that have both points of attachment on or within the larynx itself. And these are muscles that are responsible for tensing the vocal folds, relaxing the vocal folds, abducting the vocal folds, pulling them apart, and adducting them, meaning pulling them together for phonation. And it's important to note that you abduct the vocal folds, you pull them apart so that you can breathe. You adduct the vocal folds, you bring them together so that you can phonate and do some more things that we're not going to talk about in this class, but primarily you adduct them for phonation and some other reasons. You tense the vocal folds to increase your frequency, meaning the pitch of your voice, and you relax your vocal folds to decrease your frequency, meaning to decrease the pitch of your voice. So abduction is for breathing. Adduction is for phonating. Tensing the vocal folds, stretching the vocal folds, increases frequency. Relaxing the vocal folds decreases frequency. You have the two muscles that are the thyroarytenoid muscles. Thyroarytenoid, meaning it runs from the thyroid cartilage to the arytenoid cartilages. And so you can see that these things here are running from the thyroid to the arytenoids, and they're the vocal folds. And that's exactly what the thyroarytenoid muscles are. They are the vocal folds. And the vocal folds are divided up into two divisions. Two individual muscles make up the vocal folds. They are the thyrovocalis and the thyromuscularis. The thyrovocalis is the one that is most medial, so the one in the middle. So if you're looking at this image, so this is looking down on the larynx, just like I've positioned it here. So down here, you have the arytenoids, just like here, you have the arytenoids. And up here, you have the thyroid cartilage, just like here, you have the thyroid cartilage. And you see that the vocal folds run from the back of the thyroid cartilage back to the arytenoids. And illustrated here are the two divisions of the thyroarytenoid muscles, the thyrovocalis, which is that one that is most middle, and to either side of the thyrovocalis, you have the thyromuscularis. The thyrovocalis is known as a tensor of the vocal folds. So think of the thyrovocalis as basically being the vocal folds. And if they run from here to here, from the thyroid cartilage back to the tips of the arytenoid cartilages, if that muscle contracts and shortens, it's going to tighten itself. And if it tightens itself, it's tightening the vocal folds because it's a big part of the vocal folds. It's the middle part. It's the part that is vibrating. So when the thyrovocalis contracts, it tenses the vocal folds. All right, so moving on to the thyromuscularis. So you can see that to the outside of the thyrovocalis, you have this black portion of the vocal folds. That is the thyromuscularis. And you can imagine that if the thyromuscularis, if these two black bands, if those contracted, then it's going to pull the arytenoids closer to the thyroid cartilage. So my thumb is the thyroid cartilage up here. My thumb and forefinger down here are the arytenoids. So if my thyromuscularis contracts and pulls the arytenoids closer to the thyroid cartilage, you can see that the vocal folds are going to be looser. They're going to relax. So here we are at a point of rest. I contract the vocal folds. Here we are at a point of rest. If the thyromuscularis contracts, it is going to pull the arytenoids a little bit closer to the thyroid, which is going to relax the vocal folds. So the thyromuscularis is known as a relaxer of the vocal folds. The next muscle we're going to talk about is the posterior cricoarytenoid. So posterior, meaning that it is on the back of the larynx. Crico, meaning it runs from the cricoid up to the arytenoids, cricoarytenoid. The posterior cricoarytenoid is the lone abductor of the vocal folds. It is the only muscle that abducts the arytenoids and therefore abducts the vocal folds. So it is illustrated here on this drawing, this red mark right here. And I've drawn my arrows. If this muscle contracts, it is going to pull this side of the arytenoids in. It's going to rotate the arytenoids. It's going to rotate the backs of the arytenoids in. And if you see my fingertips, if this is where the vocal folds are attached to the arytenoids, and if the posterior cricoarytenoid contracts and rotates the back inside like that, then the tips of the arytenoids are going to be moving away from each other. And if the tips of the arytenoids are where the vocal folds are attached, then they are going to be moving the vocal folds apart. And that is how the posterior cricoarytenoid works. So looking at this image, this part of the arytenoid is going to be pulled in like that. And if that's rotated in, then these tips are going to be rotated out. And when the tips rotate out, they're going to pull the vocal folds along with them. So posterior cricoarytenoid, the lone abductor of the vocal folds. The muscle that directly opposes the posterior cricoarytenoid is known as the lateral cricoarytenoid. And it runs from the front bottom of the cricoid up and attaches to the arytenoids like this. So keep in mind that this is anterior, this is posterior. So whereas the posterior cricoarytenoid muscles, when they contract, they're going to pull the arytenoids like this, which is going to swing the tips of the arytenoids apart. The lateral cricoarytenoids are going to pull the sides of the arytenoids like this. They're going to make the arytenoids rotate like this, which if you see is going to rotate the tips of the arytenoids together. And if the tips are where the vocal folds are attached, and they are, then you can see that this would be rotating the vocal folds together. So the lateral cricoarytenoid muscle is a muscle of vocal fold adduction. So let me draw these arrows. So here's the lateral cricoarytenoid, right here to here. So if this muscle contracts, it is going to pull that arytenoid, this back of the arytenoid that way. It's going to pull this back of the arytenoid that way, which is going to cause the arytenoids, the tips of the arytenoids, to rotate towards one another. So it's going to pull the vocal folds together. So the lateral cricoarytenoid is an adductor of the vocal folds. All right, let's look at this image now. So we're changing perspectives. We've gone from looking at the larynx from this perspective to now we're looking at it from this perspective. So here is the back of the cricoid cartilage, and then you have the arytenoids on top, and then here you see that here. This is the back of the cricoid cartilage, and here you have the arytenoids sitting on top. Here is a view of the posterior cricoarytenoid muscle from this angle. So this is the muscle that we talked about. When it contracts, it rotates the vocal folds like this, abducting the vocal folds. Now, if we were to put a muscle directly between the arytenoids, we would call them the interarytenoids, between the arytenoids. And we have those muscles. They are the transverse and oblique interarytenoids. Transverse meaning horizontal. So the transverse interarytenoids look just like this. The fibers of the muscle run straight across between the two arytenoids. And so obviously if this muscle contracts, it is going to pull the arytenoids together. And if it is pulling the arytenoids together, it is adducting the vocal folds. And there is the oblique interarytenoid, and this one forms an X. So whereas the transverse interarytenoids were simply just the fibers run straight across, the oblique interarytenoids form an X. Both interarytenoids, when they contract, work to pull the arytenoids together. So they are muscles of adduction. So to review where we are, we have the thyrovocalis, which is a tensor of the vocal folds. We have the thyromuscularis to the side of that, which is a relaxer of the vocal folds. We have the posterior cricoarytenoid seen here in this image and seen here in this image, which is the lone abductor of the vocal folds. We have the lateral cricoarytenoid seen here in this image, which is an adductor of the vocal folds. And then we have the interarytenoids, transverse and oblique, which are adductors of the vocal folds. One more muscle we're going to talk about, the last intrinsic muscle of the larynx, is the cricothyroid muscle, and I mentioned this in class. This is the muscle that runs from the cricoid cartilage to the thyroid cartilage. And its purpose is that it is a tensor. It is the primary tensor of the vocal folds. So once again, looking at our vocal folds like this. So this is thyroid cartilage, and my fingers down here are the arytenoids. The cricothyroid muscle pulls the thyroid cartilage forward. And if you pull the thyroid cartilage forward, you were tightening the vocal folds. You were tensing the vocal folds. So that's the cricothyroid. Okay, so let me show you this mechanical demonstration I have here. So this represents the thyroid cartilage. This ring represents the cricoid cartilage. These pieces represent the arytenoid cartilages sitting on top of the cricoid cartilage. Now, I have a number of rubber bands here that represent muscles. This rubber band that runs from the tips of the arytenoids to the back of the thyroid represents the vocal folds, the thyroarytenoids. Here we have the posterior cricoarytenoid and the lateral cricoarytenoid. So let me try to hold this where you can see it. So let's say our posterior cricoarytenoid. We're going to contract the posterior cricoarytenoid, which is going to pull these tips of the arytenoids like this. And you see that the tips that the vocal folds are attached to are pulled apart. So the posterior cricoarytenoid, when it contracts, it abducts the vocal folds. You see that right here as the vocal folds are pulled apart. We move to the lateral cricoarytenoid. When the lateral cricoarytenoid contracts, you are going to see that the tips of the arytenoids are going to be pulled together like that. So the lateral cricoarytenoid is a adductor of vocal folds. Last issue we're going to talk about is Bernoulli principle. So before we talk about Bernoulli, I have to address that when the vocal folds are abducted, they're very far apart. No vibration is happening. And then when the vocal folds are adducted, they're brought together. And when they're brought together for phonation, it is the pushing of air between them that makes them vibrate. So when I blow between the rubber bands, what's happening is that the two sides of the rubber band are being pushed apart, and then the air rushes between them. And when the air rushes between the sides of the rubber band, they're sucked back together. And then I'm still blowing so that they're blown back apart. And then the air rushes between them and they're sucked back together. This is analogous to vocal fold vibration. When we phonate, we adduct the vocal folds. But that's not phonation. That's just getting ready for phonation. We adduct the vocal folds. And then we begin our expiration. We begin to push air between the vocal folds. And the vocal folds are blown apart for a second. And when they're blown apart, as you can see here in these illustrations, air rushes between the vocal folds. And when air rushes between them, it creates a vacuum, a suction. It sucks them back together until they're blown apart again. Air rushes between them and sucks them back together. And that happens however many times per second that happens. That is your frequency of vocal fold vibration. So for me talking at this frequency, that's probably happening 150 times per second or somewhere thereabouts. So the Bernoulli principle is the idea that when airflow is pushed around a constriction, it creates a vacuum. It creates a suction. So looking here, the airflow is pushed around the constriction of the vocal folds. Airflow is pushed around the constriction of the vocal folds, and they're sucked back together. Then the pressure beneath them blows them apart. Air rushes between them, And when air is rushing around the constriction of the vocal folds, they're sucked back together. So that is Bernoulli, and that is how vocal fold vibration occurs. Vocal fold vibration is not the result of muscle contraction. It's the result of the aerodynamics of Bernoulli. All right, so let's look at this video. It's going to go in slow motion, showing you vocal fold vibration. So vocal folds are being blown apart, sucked back together. This action that you're looking at, that's not abduction and adduction, that's vocal fold vibration. The vocal folds are adducted. They have to be brought together to vibrate. So what we're seeing here is the vocal folds are adducted and vibration is occurring. And what's happening is air pressure below the vocal folds is blowing them apart. Air rushes between them, creating a vacuum because of Bernoulli, and they're being sucked back together. And this is happening hundreds of times per second